It's called the silent thief. Osteoporosis affects many of us as we age. Fractures from osteoporosis are more common than heart attack, stroke, and breast cancer combined. There are ways to prevent the condition earlier in life.
And now, To Your Health, brought to you by 3rd Avenue Pharmacy and Heart Drugs.
Pharmacist Mike Lazant uses an ultrasound on the radial bone to check bone density. Part of this screening can help patients to understand whether or not they are at risk for developing osteoporosis later in life.
Osteoporosis is a weakening of the bones. It's a thinning of the bone structure, which then can lead to either fractures, like vertebral fractures, or commonly it's the wrist fracture that will happen from, again, a fall at a standing height.
Osteoporosis is defined as a disease characterized by low bone mass and deterioration of bone tissue. This leads to increased bone fragility and risks of fractures. It's known as the silent thief because bone loss occurs without symptoms.
People do not know generally that they have it until they fall, till they break a bone, or until they have like a vertebral fracture. And so until that time, people don't really know, which is why we do these screening tools, these screening clinics, to try and help people who may be more at risk to determine level of risk and the chance of developing osteoporosis.
The overall yearly cost to the Canadian healthcare system of treating osteoporosis and the fractures it causes was over $2.3 billion in 2010.
It's a little more prevalent in women than it is in men, and age doesn't seem to be too much of a factor, though of course the older we get, the more likely we are to develop it. And women, of course, after menopause, their bone density starts to decline quite rapidly.
There are ways to protect yourself against osteoporosis. 3 main factors essential for keeping your bones healthy throughout your life are adequate amounts of calcium, adequate amounts of vitamin D, and regular exercise. To Your Health, Catherine Hansen, CKPG News.